Hey guys, Dr. Childs here. Today we're going to be talking about why doctors are so hesitant to prescribe T3 thyroid medications like Cytomel, liothyronine, or even medications like Armour Thyroid, which have a little bit of T3 found inside of them. So if you're a thyroid patient and you've been in this game for any length of time, I'm sure that you have heard about the benefits of T3 containing thyroid medications. Perhaps you've had a friend or someone you know, or maybe you've seen a video like this, which talks about the benefits of T3 and you've seen how beneficial they can be. And maybe you've gone to your doctor and said, hey, can I try this medication? I've seen a lot of benefits from other people who have used it and they said it was great. Can I try it? Only to be met with a lot of resistance. So your doctor will say no, or I don't do that, or no, it's dangerous, or whatever it is. Your doctor won't do it. And then you guys come back to me and you say, hey, what's going on? I thought T3 was amazing. Why is my doctor so scared to use it? Well, that's what we're going to be talking about today. So if you are somebody who has been met with that situation or has experienced it, then you'll find this information very helpful because it will allow you to get into the mind of your doctor to better understand why they are not willing to prescribe it, even though it is very beneficial and has the potential to probably help you feel a lot better. So let's start with number one. And number one is familiarity. So this is actually a really important concept because a lot of doctors will tend to only prescribe the things that they are comfortable prescribing. And that's for a lot of reasons, but probably the most common is because they know how to dose it. They know the side effects. We'll just abbreviate that, side effects. So they know what to expect when they give it to you. They say, okay, well, if I give you half of this dose, they know how to start it. They know how to titrate it. They know how to taper it. They know how to put you on it. They know how to put you off of it. There's just a lot of familiarity with certain medications. And in the world of hypothyroidism or thyroid treatment, levothyroxine is, and actually we'll say Synthroid here as well. These are the two most commonly prescribed thyroid medications. So doctors have a ton of familiarity with those two medications. They prescribed it hundreds, probably thousands of times. In fact, when you look at the total amount of prescriptions of levothyroxine, it's usually top three, meaning tons and tons and tons of people, probably you, in fact, you watching this, are probably taking it right now. So people they know what to expect. And doctors are creatures of habits, or they're a creature of habit. And that's because there are so many new medications out there that when they get introduced to new medications, there's a new learning curve. And if you're a doctor and you're slammed with a lot of patients every single day, that's probably the last thing you want to do. So unfortunately, not for the benefit of the patient, but familiarity plays a huge role in why they're not willing to prescribe it. They just don't know about it. And the good news about that is it's an easily solvable problem, right? All they have to do is become familiar with it, test it out, and try it. In fact, that's how I learned. I didn't know what to expect when I started doing it, but after a while, I figured it out, and which is why I can share this information with you. So that's number one. Number two, if they know a little bit about it, they may be hesitant to prescribe it due to side effects. So thyroid medications are generally pretty well tolerated, but there's no question that levothyroxine is considered more stable than T3, okay? And that's because it has a much longer half-life. So when your doctor gives you levothyroxine, they give you just a standard dose, it stays in your system for about 35 days. Right? And in order for your body to use it, it has to be converted into T3. So this conversion process sort of acts as a stabilizing mechanism because the body will not create more than it needs. Now, unfortunately, it usually doesn't even create the amount that it needs, but that's the logic that they're using. And they know that levothyroxine, because it's so stable, it has far fewer side effects. Now, compared to T3, that doesn't mean, by the way, that T3 is dangerous. But it does mean that T3 containing medications are a little more powerful. In fact, T3 is the most powerful thyroid hormone, which means it will cause more side effects, including things like heart palpitations. It can even cause anxiety in some people. So thyroid patients will start taking it and thinking they're on the right track, and they probably are. But if you don't know what to expect, which goes back to the familiarity part of it, if you don't know what to expect, you might be like, oh my gosh, I'm overdosing this patient, what's going on? When in reality, it's more of just about splitting the dose up or lowering the dose a little bit or taking it at a different time of day. These problems are usually really easily solved, but the side effects can cause a problem from the perspective of the doctor because they then have to manage those side effects. Again, not a reason not to take it, not a reason to be scared of T3, but just something that you should be aware of. There are more factually, this is a factually correct statement, there are more side effects when using T3 than when using T4, just the way it is. But it can be managed and you can take care of it. So that would be number 2. And then number 3, this is the total biggest cop-out ever, by the way, number 3. And that is just that we have something called the standard of care. Now, the standard of care is sort of like a set of guidelines that doctors must follow when it comes to any disease state. And basically what happens is doctors are held to a certain level of care for every single disease state. And if they go outside of those boundaries, they can either they basically get into trouble, okay? And so the standard of care is a good thing because it protects you as a patient, right? Because if you wanted to go get heart surgery, you will want to make sure that whatever surgeon is operating on your chest is operating at a sufficient level to get you the results that you want, right? Now, the problem is that's a good thing because it protects you, but it's only good insofar as the standard is actually helpful to the patient. But in the case of hypothyroidism, that's not the case, at least in my opinion, because the standard of care is actually this simple. I kid you not, it is this simple. You use levothyroxine and you check the TSH. That's it, right? That is the standard of care. So your doctor can always fall back on this and say, hey, this is what everyone else is doing. We don't have to do anything else because this is it. And your doctor is protected. They're not going to get into trouble if they prescribe T3 medications. They're not going to get into trouble if they suppress your TSH or if they do something like that. So it's a very safe, just sort of middle of the road ground for them. And at the end of the day, they're worried about themselves and they're worried about their license and they're worried about, making money for their family or whatever it is. So, and the truth is you can put yourself into a little bit of a risky situation by exiting the standard of care for thyroid patients. Now, unfortunately, I think probably a lot of you listening to this would probably agree that the standard of care is just not an acceptable level of care for most thyroid patients. It leaves the majority of you feeling symptomatic. And that's why a lot of you listen to things like this and you go out and you try to get new medications, you try to take supplements, you try to do natural therapies because you're trying to feel better, right? So I'm hopeful that the standard of care will change. And if it does, that will really be all that we need for most thyroid patients. Now, it will take some time for that to occur. And that's what a lot of stuff that I do right now is just informing and educating, trying to push this new standard of care out. And there are a lot of other doctors who are doing this. I'm not the only one. And so there are plenty of people doing this. The problem is there's just such a huge time delay between when things are shown to be superior and when they're actually applied in clinical practice. And on average, that takes about 17 years, unfortunately. So this is why this information for you is so important now. And I would say the last one, number 4, is a matter of convenience. So this one kind of goes back to side effects, which we talked about here, but convenience is an important part not from the patient perspective, mind you. I'm talking about from the perspective of the doctor. Doctors are always thinking about the convenience of themselves. So let me give you one example. If you're a labor and delivery nurse, you'll know what I'm talking about. But there is an increased number of women who end up with C-sections around 5 o'clock. And that's because the doctors go home and they would rather do the C-section at 5 than they would rather be called back in a couple hours or in the middle of the night. Now, this is absolutely not acceptable for the health of the patient, right? But a lot of doctors will do this. They will rather take the convenient route than which means more work on their part or less work on their part than doing what's better for the patient. Now, not every doctor does this, but it definitely happens. And like I said, if there's any L&D nurses, feel free to share your experience because I've personally seen this happen. I've heard a lot of stories about that happening, and it happens in other areas as well. So you can imagine if you're taking T3, which has a higher number of side effects, that means the doctor is going to be getting more calls. The nurse is going to be getting more calls. There's going to be a lot of just increased work for the doctor. So versus taking levothyroxine, they can just say, hey, take this dose, call it a day. We know you're probably not going to have any issues. So, our hands are clean, no worries. Now, again, unfortunately, that's not what's best for the patient, but it does play a role in how doctors are thinking about some of these things. So hopefully this gives you a better idea as to why many doctors, not most, but many doctors are just unwilling to prescribe T3 medications. It's not because they're dangerous. I've debunked the idea that these T3 thyroid medications are dangerous before. It's more of just a matter of dosing. It's not a matter of the medication being harmful in any way. As long as they're dosed correctly, as long as you're taking the right amount for your body in combination with the right other hormones or the correct other hormones, then they are very safe to take long term. So you don't really need to worry about that, but it can be hard to find the right doctor who's willing to prescribe them for you. And that's really where the difficulty lies. So if you have anything else to add to this, or if you've had another experience, leave your questions or comments below. I do my best to answer those. If you haven't already, make sure that you download my free thyroid PDF resources. I have tons of information, all designed to help thyroid patients like you feel better. So if you found this sort of information helpful, I think you'll like those downloads as well. So otherwise, that's all I have, and I will see you guys in the next one.